Hello, I'm Julie, and I'm a nurse. Your doctor has prescribed a medication for you, and I'll be explaining the possible side effects, as well as how to manage your health while taking your medication. Medications such as risperdol, zyprexa, abilify, and seroquel have been shown in research studies to increase the risk for developing type 2 diabetes. They may also cause weight gain, high blood pressure, and high cholesterol. While taking these medications, it's very important that you watch what you eat and know the symptoms of diabetes and high blood pressure so that you can report these to your doctor if you notice that you start experiencing any symptoms. So what is type 2 diabetes? Diabetes means high blood sugar. When your blood has too much sugar in it, it can be toxic to your system and cause a whole host of health problems. Diabetes is caused by a problem in the way that your body produces or uses insulin. Type 2 diabetes is when your body makes an adequate amount of insulin, but your body can no longer use it correctly. This is also known as insulin resistance. Well, what is insulin? Insulin is a substance produced by your pancreas that controls metabolism of glucose or sugar in your blood. Insulin moves sugar from your blood into the cells where it can be used for energy and also removes excess sugar from your blood. When your body doesn't produce enough insulin or can no longer use the insulin it produces, then blood sugar levels rise. Blood sugar naturally rises after eating and then decreases after 2 to 3 hours. I'll show you a chart that shows normal blood sugar rise and fall. Okay, in green is the normal blood sugar. As you can see, 80 to 100 is normal fasting blood sugar. After eating, it rises to 170 to 200, and after 2 to 3 hours, it falls back down to 120 to 140. In a person with diabetes, they may start off with a higher fasting blood sugar. It will rise higher, and then it doesn't drop very far after 2 to 3 hours. It never comes down to normal. For diabetic people, the blood sugar may continue to be elevated even after 3 hours. When a person has high blood sugar over an extended period of time, many health problems develop, such as heart disease, kidney disease, stroke, vision loss, nerve damage, and narrowed blood vessels, which can lead to the need for amputations. So it's very important, in order to keep good health while taking these medications, that you eat right and see your doctor for regular checkups. Signs and symptoms of diabetes include increased thirst or dry mouth, increased hunger, especially after eating, cuts or bruises that are slow to heal, recurring gum or bladder infections in the skin that don't heal, unexplained weight loss, headaches, tingling or numbness in the hands or feet, and extreme fatigue or irritability. If you notice any of these symptoms, please report them to your doctor immediately. Your doctor may have you start monitoring your blood sugar levels. If so, your doctor will tell you how often to check your blood sugar, but a typical schedule would be before meals and at bedtime. To check your blood sugar, you need a glucometer. A glucometer is a device that measures your blood sugar, and these can usually be bought at your local drugstore. Some insurances, I should say most insurances, will pay for these devices if you're diagnosed with diabetes. You'll want to check with your doctor's office for more information on that. To check your blood sugar, you need a blood sugar glucometer, test strips, which look like this, and a lancet. This is the lancet itself, and then you load it into this device in order to check your blood sugar. So to load it in, this one's already loaded, but just stick it in here, remove the brown protective device that will reveal the needle, stick this back on, and it's ready to go. You're going to want to hold it against your fingertip, and you press the device, and it will pierce your skin and produce a drop of blood. One thing to keep in mind is you want to make sure that you have a clean fingertip. You may want to use an alcohol swab to wipe it with, and if you do, use a sterile pad to wipe it off. You don't want any alcohol to remain on the skin. You want it to be clean and dry before you check your blood sugar. So after you've got the little drop of blood, you put the strip against the drop of blood, and the glucometer will tell you your blood sugar. As I said, a normal blood sugar would be 80 to 100 for fasting. You want to keep track of your blood sugar levels so that you can report them to your doctor. Your doctor may prescribe a medication for you to keep your blood sugar under control, and if so, they'll let you know how to take the medication and how often to check your blood sugar. Another side effect of your medication is that it may cause weight gain. To counteract this, you're going to need to exercise and eat healthy. The recommendations for healthy eating and exercise will also help keep blood pressure in a normal range and keep your cholesterol levels in check. Sustained high blood pressure can cause serious consequences such as heart failure, heart attack, stroke, and kidney failure. So you want to choose foods that have low sodium also, because high salt increases your blood pressure significantly. To lower your cholesterol, you want to eat low fat. So if you go to a website called choosemyplate.gov, you're going to see this diagram. This gives healthy eating recommendations for anybody, really. But you want to keep your fruits and vegetables about half of your meal, grains and proteins, and then dairy here on the side. The website has great advice for everyone. Basically, just reduce your salt, sugar, and fat intake while increasing fiber and nutrients. You definitely want to avoid eating fast food, because fast food typically has too much salt in it. You may find some healthier items at fast food restaurants like salads, but make sure to look at the ingredients on the salad dressing to make sure that there's not a whole lot of salt and sugar in it, because they tend to be loaded with salt and sugar, unfortunately. Eating healthy on the go can be a problem if you don't know what foods to buy. Some of the foods I recommend are Greek yogurt. It's non-fat, it's got natural fruit in it, so it's loaded with fiber, nutrients, it's low fat, and it's only got 130 calories per serving. This is really portable, and it's fantastic. It's great for you. Another thing I like to recommend are these salads from Bistro Bowl. It's prepackaged. It's got everything you need to make a salad. It's got protein, dairy, salad. Comes with a fork, salad dressing, the whole bowl, only 230 calories. Very healthy. A great thing to eat for breakfast is going to be oatmeal. And this one has fiber, lots of fiber due to the flaxseed, which is really healthy, really good for you. Comes in a little packet like this. You just dump it in a bowl, add a little milk or water, stick it in the microwave, and you're ready to go in about a minute. A nice snack to take with you, Zone bars. Perfect balance of protein, carbohydrates, and fats. This one only has 210 calories per serving. These are great, very tasty. If you do find that you need a sweetener, I recommend choosing a sweetener that's low in the glycemic index. And what that means is that the lower on the glycemic index, the slower the carbohydrates enter your system. So a good choice might be coconut sugar. This is really tasty, very low glycemic. It doesn't raise your blood sugar. Or you might try agave syrup, agave nectar. Very tasty and won't raise your blood sugar. So I want to show you a chart. This kind of puts it into a nice visual. You can see the dashed line here indicates fruit sugar. It doesn't raise your blood sugar very high. This one is table sugar, regular table sugar. It really raises your blood sugar and then drops it significantly. So if you're gonna eat sugar, it's best to stay with some fruit sugars or something that doesn't raise your blood sugar. If you have any further questions regarding how to eat, check with your doctor or go to the websites that I've mentioned. Remember to eat for energy and not for boredom. Okay. Now I'm going to talk about exercise. Walking is the easiest exercise because it only takes a pair of shoes and you're off. and running or walking. The American Diabetic Association sponsors a campaign called Step Out, Walk to Stop Diabetes. They recognize that walking is the best form of exercise. Their website is www.stepout.diabetes.org. It's got excellent information on how to start a walking program. Walking has so many health benefits, some of which are it reduces coronary artery disease, improves blood pressure and blood sugar, decreases high cholesterol, lowers body weight, enhances mental well-being, reduces the risk of osteoporosis, reduces the risk of breast and colon cancer, and also it's been shown to reduce the risk of type 2 diabetes, which is what I've been talking about. Doctors recommend 30 minutes of walking every day. So you may ask, how can I walk 30 minutes every day? Well, you might use little tricks like I do. When I go to the grocery store, I might park at the farthest part of the parking lot, walk 10 minutes into the store, 10 minutes back to my car, and I've got almost all of my walking requirements in for the day. It just takes a little creativity to get walking into your daily routine and not a lot of fancy equipment. So, if you're finding you're having any trouble following any of these recommendations, please talk with your doctor. They may have other suggestions for you. Take care and be well.